Hello, and welcome to this CPD Bite. My name is Professor Tracey Thornley, and I'm a member of the FIP Antimicrobial Resistance Commission based in the UK. In this short session, I'll be highlighting how pharmacists can play a key role in supporting symptom-based care for sore throats. We'll explore how a stewardship-focused approach can help ensure appropriate use of antibiotics, improve patient outcomes, and reduce the spread of antimicrobial resistance. By the end of this session, you should be able to outline when antibiotics are appropriate and when symptomatic care is recommended, understand the risks associated with unnecessary antibiotic use, identify and be able to recommend evidence-based self-care strategies for symptom management, and finally, know how pharmacists can educate patients about antibiotic use and symptom relief. Firstly, let's begin with some context. Sore throat is a symptom often caused by an inflammatory process in the pharynx, tonsils, or nasopharynx. The majority of cases are viral in nature and self-limiting. Symptoms can last for around 1 week, but most people will get better within this time without antibiotics, regardless of its cause, whether it's bacteria or virus. This often means treatment should focus on relieving symptoms and discomfort whilst the infection runs its course. Symptom relief options that reduce local pain in the throat area and inflammation tend to offer the greatest benefits to patients. Sore throat happens to be one of the most common upper respiratory tract infections, which is associated with the misuse of antibiotics. Based on a systematic review conducted in 2020, over 37 million courses of antibiotics are prescribed for sore throats yearly, and this is a major driver of antimicrobial resistance. To put this into perspective, antimicrobial resistance, or AMR, is now recognised as one of the top 10 global public health threats. And if no action is taken, projections indicate that it can result in up to 10 million deaths annually by 2050 due to resistant infections. This overuse is not without risk. So how do we know when antibiotics are appropriate? Well, making a good assessment is a good way to start, and ideally it should include a 3-step approach. Begin with thorough history taking, including both medication and non-medication related questions. And remember that patients are usually the best source of information about themselves. This should be followed by a focused clinical assessment, and consider using validated tools like Centaur or fever pain scores to supplement history taking. If available, point-of-care tests can help inform decision-making. But remember that point-of-care tests must be interpreted alongside clinical findings, since some patients, such as asymptomatic strep carriers, may test positive. In such cases, the results are not clinically relevant, hence there is no need for antibiotics. Antibiotics should be used only when a bacterial infection is confirmed or highly suspected, such as in cases of group strep A pharyngitis. However, it's important to know that studies show antibiotics reduce sore throat duration by only about 1 day, which could be as low as just 8 hours or by up to 24 hours. This modest benefit doesn't justify routine use, especially when symptoms are likely caused by a virus. It is also important to note that patient satisfaction is not related to antibiotic supply, but rather to the relief of symptoms. When antibiotics are appropriate, penicillin-based medications are typically first line. Cephalosporins and macrolides may be considered as second-line options in cases of allergy or treatment failure. Macrolides are a good alternative choice for penicillin allergy or where there's intolerance for people who are not pregnant. Erythromycin is an alternative first choice for penicillin allergy in pregnancy. But it's important to note that selection should always be aligned with local guidelines and resistant patterns. Many evidence-based treatments exist to relieve sore throat symptoms, without antibiotics. These include analgesics like paracetamol, ibuprofen, or aspirin, short courses of oral corticosteroids for adults or for more severe cases, topical options that can help reduce local pain relief, and antiseptics. Lozenges, sprays, drops, and mouthwashes can also help reduce local inflammation and improve comfort, making them very useful in symptom-based care. Let's now explore the connection between sore throat and cough, as often these symptoms occur together. But even though they appear together, they may need different symptom-based treatments. So how do we handle this in practice? Well, when managing a sore throat, the priority is to relieve pain and reduce inflammation. But for a cough, the treatment depends on the type. If it's a dry cough, the goal is usually to suppress the cough. If it's a productive or wet cough, we aim to help clear the mucus. So let's go a little deeper into the treatment options for each cough type. For a dry, non-productive cough, we can recommend emulsants like simple linctus or honey. But note, honey is only recommended for children over 1 year and adults, according to NICE guidelines. We can use antitussives such as dextromethorphan as well. For a wet, productive cough, we can suggest mucolytics to help break down the mucus, or expectorants to assist with mucus clearance. Supportive options such as steam inhalation or humidified air can help to soothe the airways. Matching the right treatment to the cough type helps patients feel better, faster, and reduces the chances of them expecting antibiotics unnecessarily. For most sore throats, simple self-care strategies can go a long way in easing discomfort and supporting recovery. A few recommended ones include getting plenty of rest, drinking warm, soothing liquids, soothing the throat with a lozenge or hard candy, and avoiding smoking and smoky environments. Some other helpful practices are resting the voice until the throat feels better, using humidified air or steam inhalation, saltwater gargles, and for pain or fever, paracetamol or ibuprofen can be considered. We should educate patients on when antibiotics are needed and when they're not, and help patients understand that most sore throats are viral and do not need antibiotics. We should also educate them on the natural course of a sore throat and how long symptoms may last, highlighting that symptoms usually improve within 5 to 7 days without the need of antibiotics. And the risks of antibiotic misuse, including resistance and side effects. We can further improve outcomes by informing patients on when to seek further care, by educating them on red flag symptoms that require medical attention, reinforcing adherence to prescribed antibiotics, explaining how to use medications correctly, and promoting non-antibiotic alternatives. To conclude, not every sore throat needs antibiotics. Encouraging non-pharmacological and self-care approaches can lead to better outcomes. As pharmacists, we must continue to lead in patient education, promote evidence-based self-care strategies, and ensure better healthcare outcomes through effective stewardship. And always remember that judicious antibiotic use helps reduce antimicrobial resistance. Thank you.